By the end of the century, Uganda is poised to become one of Africa's most populous countries. It's been experiencing steady and rapid population growth since the late 20th century and is showing no signs of slowing down. Approximately 1 million people are added to the population each year. Uganda's population has doubled since the year 2000, from 23 million people to almost 50 million. It's expected to hit 100 million by 2050 and reach over 160 million people by 2100. This would put Uganda amongst one of the world's most densely populated countries. Only Nigeria, with 213 million people, will rival Uganda in terms of sheer population size in Africa. In 1960, Uganda's population was a mere 6 million people. It's been increasing at a steady rate of around 3% per year, making it one of the fastest growing countries on the planet. The world's average population rate is around 1%, with some countries such as Japan and Italy actually recording negative population growth. The regular and steady increase isn't just restricted to Uganda. It's a common pattern across sub-Saharan Africa, with many countries experiencing annual growth rates of at least 3%. Uganda's rapid population boom has resulted in it having one of the world's youngest median ages. The average age of someone in Uganda is just 15. This makes it one of the world's youngest countries. Again, however, this is another characteristic of many African countries. The 10 countries with the youngest median ages are all in Africa. Niger, Chad, and Uganda are at the top of the list with an average of 15. So what are the factors behind Uganda's population boom, and how will a country with this incredibly young population fare in the future? First, the surge in births. There are several factors at play, but the single biggest reason is the widespread scarcity of birth control policies. This, combined with a general lack of education regarding family planning, plus traditional cultural beliefs, has Uganda's fertility rates remain consistently high. It's estimated that just 20% of Ugandan women have access to birth control. On average, women in Uganda give birth to 6 children, a staggeringly high number. Not only does this far exceed the global norm of 2.7, but it is a big number even for Africa. The African average of babies per woman is just over 5. And it's not just a matter of women being unable to access contraception. A common theme in African countries with high fertility rates is the corresponding low level of urbanization. It's estimated that only 30% of Uganda's population lives in urbanized areas. With farming still forming a major part of the economy, families opt for more babies. More babies equals more help at the farm. And as an insurance against child mortality, the more the better. Uganda also has seen a significant decline in mortality rate, which has further contributed to the increasing population. Hospitals have benefited from better trained staff and improved facilities and supplies. Greater numbers of midwives have also had a huge effect on reducing the mother and childbirth mortality rates. More medical clinics, improved water supplies, and the availability of medicines have also been important in preventing deaths from disease and sickness. Cultural factors also come into play. The use of birth control is frowned upon by many older and influential members of these sub-Saharan African societies. It's seen as unnatural and clashes with traditional religious beliefs. High fertility rates are seen by many as not just crucial to help support family farms, but also as a sign of health and vitality. Traditionally, large families were a sign of prosperity and economic independence. Religious beliefs centered around the importance of maintaining ancestry for future generations has also encouraged high rates of fertility. These views, plus the lack of contraception, a low urbanization rate, and insufficient education, have seen Uganda's population skyrocket since last century. For this, Ugandan governments must accept the bulk of blame. Since the late 20th century, there's been a systematic failure to properly educate young Ugandans on family planning. Coupled with inadequate development policies, it's a little wonder that the population has been increasing so rapidly. Unfortunately, Uganda's health and education systems have failed to keep up with the boom, resulting in overcrowded schools and not enough access to healthcare services. Almost 80% of the population is aged under 30, and this astonishingly young age structure will have a huge impact on Uganda's future development. The challenge for Uganda will be to take advantage of its young population and build a flourishing workforce that will grow the economy. While some countries in the developed world are feeling the strain of aging populations and shrinking workforces, Uganda's at the other end of the spectrum. If the right investments and policies are made, it has the potential to develop into at least a middle-income country. Still, the most pressing issue is to obviously put the brakes on the fertility rate. It's reported that about 30% of young Ugandans are married by the time they're 18, and even more have become parents well before then. This high rate of adolescent pregnancies causes several problems. Girls are forced to drop out of high school so they can look after their children, and this severely limits their chances of entering the workforce later on, which stifles economic growth. Big families with only one parent working to support them mean even greater levels of poverty. Added to this is that teenage mothers are far more likely to divorce, which brings a whole new set of social problems. So what can the government do? Well, a lot. Nowhere near enough funding has been injected into birth control and family planning programs. The government should be providing affordable and effective education to its youth with an emphasis on the benefits of lower fertility rates. Restricting child subsidies is another option for promoting lower birth rates. For example, if the government limits family support to the first 2 or 3 children, couples will be less likely to want large families. The next step is to then make sure contraception is widely available and, most importantly, encouraged. All the education in the world counts for very little if opposing views on birth control don't change. Less than 25% of Ugandan women have reported making decisions on pregnancies and healthcare in their families. If lower fertility rates are acknowledged as a goal worth pursuing, then Uganda can start progressing towards slowing down its population growth. Family planning is not only saving money, but it also promotes economic growth. When young Ugandans are educated on the benefits of smaller families, they can start to plan when the next child should be born. This allows mothers to not only complete their education, but then to contribute to the economy by joining the workforce if they so please. The kind of work that's available to people in Uganda must also start to change. The growing rural to urban shift has so far resulted in high levels of unemployment. This will be the Ugandan government's next challenge, to start investing in and creating new industries that create jobs. Uganda's GDP per capita currently sits amongst the world's lowest at just under $1,000 per person. The goal is to increase this up to around $9,000 by 2040. Uganda's economy is largely based on its natural resources, with agriculture and oil making up the bulk of its production. As the country becomes more urbanized, the focus will be on developing the service and tech sectors. With more people completing their education and more women entering the workforce, Uganda is banking on a greater consumer consumption and growth in new industries. International investment and support is going to be crucial. If Uganda is shown to be making positive steps in managing its population growth, other countries will be more likely to step in and do business. The good news is that Uganda's government is starting to put its money where its mouth is. The investment in fertility control programs is increasing, as is the provision of affordable and effective methods of contraception. The immediate goal is to educate Uganda's youth on the long-term benefits of controlled and planned births. A step in the right direction will be aiming to reduce the average number of children per family to 3 or even 4. At the same time, mothers are being encouraged to wait at least 2 years before having another baby. The widespread national campaign that promotes smaller-sized families is already underway. In urban areas, billboards and TV ads depict smiling families with just 2 children, leading happy and prosperous lives. Uganda is serious about making changes and taking advantage of its young population. The future blueprint called Vision 2040 highlights what the government hopes to achieve and how they plan to do it. Basically, it means drawing on its massive numbers of young workers and moving away from being an agricultural, rural economy. The vision is to transform into an urbanized nation focused on developing its technological and service sectors. The blueprint's in place. Now it's up to Uganda to follow it.